Welcome everybody, we're here at National Integrated Health Associates. I'm Anita Capizzi and welcome to this edition of Anita's Healthy Tips. You know, I like to use foods that give me the biggest bang for my buck. One of those foods is cinnamon, which I want to talk to you a little bit about today. So cinnamon has so many great health properties. There's no way I can list all of them, but I'll talk about a few of them. One of the best things that I like about cinnamon is its ability to lower blood sugar. It lowers total cholesterol and LDL cholesterol, and it lowers triglycerides. Back in 2003, the USDA did a study with 60 people, and over a 40-day period, they gave these people quarter teaspoon of cinnamon in the morning and quarter teaspoon of cinnamon in the evening. And they did it for 40 days, and at the end of that 40 days, all those numbers, the blood sugar, the triglycerides, the cholesterol, all of those numbers came down. And what's even better is that they checked those people again 20 days later, and 20 days later the effects were still relevant, even after they had stopped using the cinnamon. It's also an anti-inflammatory, which speaks to coronary artery disease and arthritis. Certainly there was a study done in Copenhagen. They gave people a teaspoon of cinnamon in a tablespoon of honey every day before breakfast, and these are people that suffer from arthritis. At the end of the week, they reported significant reduction in pain, significant more ease of walking in the morning. So I think those two things are pretty significant in that it lowers your numbers and it increases the anti-inflammatory effects in the body. So one of the best ways that I like to use cinnamon is on, I don't know if you could see it, some sliced apples here. I just pour cinnamon all over because I like the taste of cinnamon. So apples with cinnamon. Another way you can use the cinnamon is in a smoothie. I don't have my big machine here, but I've got the blender. Some milk, a banana, and some cinnamon. Put it in there with some ice, blend it up, and you have a delicious afternoon smoothie. One of the caveats of using cinnamon that I kind of want to get into is that it can be toxic at high doses, and so you're thinking, well, what's a high dose? What I've read is anything over half a teaspoon a day is a high dose. So, and I'm talking about if you're using it regularly. A couple of things I do want to mention though, if you're going to be using cinnamon, if you are on blood thinners like Coumadin or heparin, cinnamon has anticoagulant properties, so want to be careful and talk to your doctor first about that. If you are on statins for cholesterol, certainly don't want you to start using cinnamon instead of, without speaking to your physician first, because cinnamon has good properties, but we don't want to wipe out the good properties of the statins either. You need to talk to your doctor first. If you're on blood sugar medication, any kind, whether it's pill form or insulin, and you decide to start using cinnamon, please, 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 be checking your blood sugars more frequently during the day and let your physician know that you're taking that. And who shouldn't use cinnamon? Probably if you're pregnant during the last trimester, not a good idea because it can cause uterine contractions. If you're in a pre-op stage and you're going to have surgery soon because of the blood thinning abilities, probably want to stop using the cinnamon then. But other than that, cinnamon is such a great spice to use, and all of us have it in our spice cabinets. Use it with your tea at night. Use it on your oatmeal. Use it on in your Indian foods. It's just got so many great uses. So if you have a use that I haven't mentioned yet, post it on the blog below and share it with everybody. Have a good day.